Welcome to Expectations, the final module in this educational series. I'm Dr. Michael Warner with Patient Advocacy Initiatives. Before we move on, please answer 3 quick questions. Our government recognizes the problem of quality, cost, and satisfaction with our healthcare system. Our leaders have allowed spending to continue to grow at the expense of our federal debt because they allowed America to be leaders in innovation and new therapies. They foresaw the digital age of healthcare and reasoned that information technology will make healthcare efficient in the same manner that we have seen in other sectors of the economy. Just about everything is in place. Yes, EHR systems need to share information. They need to be interoperable. Yes, we can not only look at the first 4 diagnostic codes, we have to track more information. Yeah, we need to let patients interact with the records and contribute information. And yes, we need to be able to see all of our health record on patient portals, not just some of it. But keep in mind, most hospitals and medical offices have electronic health records, and most of our health information is now in digital format. Yet, though nearly everything is in place, we have not seen across-the-board improvements in healthcare quality, cost, or satisfaction. The reason why is because we are going through a paradigm shift. We need to change our mindset of how we use computers and how we take care of the patient. This means we need to look at the patient in a new way. In The Structure of Scientific Revolutions, published in 1962, American physicist, historian, and philosopher Thomas S. Kuhn introduced the term paradigm shift. Dr. Kuhn explained that a paradigm shift signifies a change in basic assumptions, a revolution in thoughts and actions. Patients are no longer passive bystanders in our healthcare system, and while the electronic health records and patient portals will allow for greater patient participation, it is not the computer that will change healthcare. It will be our mindset. Patients are ready to participate. They are ready to engage. Information in this series welcomes a new way of approaching healthcare, where patients and providers engage in a partnership in health. My favorite quote of Dr. Kuhn is, "A new way of looking at something becomes successful only when the old way miserably fails." Have we failed enough? Are we heading down a path that just gives doctors one more button to click? Our current standards have put focus on the computer with some unintended focus away from the patient. We have an opportunity to put the focus back on the patient with excellence in the use of computers. It can be done. Let's unburden medical providers from being clerks and stenographers. Let's capitalize on the knowledge of people who went to at least 23 years of school. Let's encourage physicians to be leaders on how medicine should be practiced. For patients who have participated through this series, you and your medical staff have something in common, because we are all patients of our healthcare system. I know you have a health story to tell. Maybe it's the way you said goodbye to someone close to you, or when you first said hello. It could be a story of what it was like to live with chronic illness. Perhaps it's a story based on what you've witnessed with a loved one who battles disease. Healthcare gives us tremendous triumph and sometimes horrible tragedy. Let's strive for excellence. As a patient, be heard and check your records to be sure your story is documented. If you are not pleased with the results, then prepare for your next visit with a prehistory. Give your medical provider all the information he or she needs to best understand you, and we are going to see great gains in American healthcare. Patient advocacy initiatives designed and delivered this educational series to recognize the needs of patients and the needs of medical providers as we enter the digital age of healthcare. We instructed you on the structure of health records, the laws that govern patient engagement, along with a process that fosters the patient-provider relationship. Let's gather data and let a new mindset emerge. Let's work together to empower patients to be heard and understood, and let's empower doctors to practice medicine. I thank you for your participation in this series. Our nonprofit is committed to finding solutions and getting the word out to you. Our forums are on our website. I encourage you to share your thoughts and stories on our Facebook page. And please watch for us on YouTube with our Patient Advocacy show. Patient Advocacy Initiatives is a 501c3 nonprofit organization registered in the state of Pennsylvania. We would appreciate any charitable donations to help support what we are doing. Best of health to you and your family. Thank you. I'm Michael.